All right. Hello, Facebook, friends and family. Hi, it's Dr. Janine with Thursday Tips. This is a special edition. All right, we're going to wait here for a little bit and see who's joining, and then we'll get started because I have a special guest today. So hold on. Let's see here. All right. Anyone that's entering, please let me know by saying hello. And then also, if you're watching later, put hashtag replay and also share. All right, so we have Shad. Thank you for joining. And I see there's some other people on, so say hello so I can acknowledge you. Hi, Priscilla. Thank you for watching and joining us this evening. How are you? Hi, Sheree. Thank you for joining. All right. Sheree says hello, Dr. Lakeisha.
Oh, Sheree, thanks for joining us. I think I have us set up. This is my first time doing a watch party on my.
Oh, okay, cool. Thank you for joining us this evening. All right. So today's Thursday Tips with Dr. Janine. This is a special edition. I'm coming live a little later than usual. I usually come on at around 3-ish, but I have a special guest here with me this evening and just waiting to see who else is joining. And then I will introduce you to my special guest. I can't wait. And this is an awesome topic for the time that we're in right now. So, get your pens and papers out, or just get your ears and just listen to this, because this is awesome. I see some other people are joining. Just say hello so I can acknowledge you. Thank you all for joining this evening. Appreciate it.
I have a couple of people that have joined my watch party. Hi, Janiza. Hi, Dr. Hyman, Dr. Ramona. How are you guys? Thanks for joining.
Hey. Okay. All right. For those of you that don't know me, I am Dr. Janine. I'm a board certified family doctor and also weight loss specialist, also board certified in obesity medicine. I help women get their sexy back by providing a comprehensive weight loss program. I'm also the owner of Lifestyle Changes, which is a virtual medical practice here in Pennsylvania. And then lately, what I've added to this title is I'm a best-selling author of Get Your Sexy Back, a book about bouncing back after pregnancy. So for those of you that have already bought my book, thank you. And later on, I'm gonna show you what has come to my doorstep. So anyways, yes. So anyways, tonight, we're going to be discussing, I think, a very important topic for right now. Yes, we are in a pandemic. Yes. And so we're talking tonight about, is COVID causing stress and weight gain? Is COVID causing stress and weight gain? All right. So if COVID is causing you stress and weight gain, put a yes in this comment in your comments, or put a high five or whatever in the comments so we can see who's having a lot of stress. All right. Okay. So I have a special guest here tonight. My husband said he is stressed. Yeah, I don't know. Maybe am I stressing him out? I don't know. But anyways, okay. Laura says yes, stress. Yes. Sheree saying stress. Okay, so let me introduce my special guest and super friend here. This is Dr. Lakeisha. Dr. Lakeisha is a gifted speaker, an OBGYN, and a hormone specialist. Yes, ladies and gentlemen, we have the hormone expert here tonight. Okay, so we can talk about those stress hormones and if you have any questions, get ready. All right. Also, she is a best-selling author. All right. Her book is The Other PMS. So it talks more about perimenopause and menopause. So we will let you know how you can get that book as well at the end here. Okay. So Dr. Lakeisha has a passion for helping women struggling with depleting hormones, getting their hormones balanced, regain mental sharpness, and also have energy to last the entire day. This here, ladies and gentlemen, is the hormone expert. She practices in Maryland, and where she resides with her husband and 2 children. All right. So we're just going to dive on in this and, talk about what are stress hormones, because this affects everything from head to toe. All right. So I'm going to let Dr. Lakeisha take the I guess the screen.
Thank you so much, Dr. Janine.
So, yes.
Thank you so much, Dr. Janine. I am so honored to be here on your show this this early evening. Thank you for being so flexible and changing your time. I know that you usually do your Thursday tidbits a little earlier, so you were able to adjust your schedule for me, and I want to thank you. I'm honored for that.
Dr. Lakeisha, we're here in the house, so.
I know, right? It's like, what are we doing? And that's what we're going to talk about, because some of what we're experiencing is this disorienting type of reality that we're all in. And with this comes an increased level of stress for a lot of us, if not all of us. And so we had started, kind of talking through messaging and things like that about how this is affecting us. And you were able to come on my show, and I want to thank you for that. And we were saying, don't let the COVID-19 give you the freshman 15, right?
Right.
So this is the flip side. This is the sister conversation to that. Yeah. Because now we're going to talk about how that can happen. How can being stressed lead to weight gain? I mean, we're all like, how does that happen? Usually when you're stressed out, you lose weight, right? Some people are like, well, I lose weight. I got stressed out. I didn't want to eat. I lost weight. And that can happen to some people, some individuals.
Yes.
But what we're going to talk about this evening is how, when the body gets a stress signal, that it then interprets that throughout different physiological processes, and the end result, what that looks like as a symptom. So I'm always talking about how things look like. What does this look like in your everyday life? Right. Because, I was telling you before the show, I tell people this all the time. We have gotten so good in medicine at dismembering the body. You know what I mean? The cardiologist takes the heart. The neurologist takes the head, the OBGYN takes the pelvis, or, for men, the urologist takes the lower half. We're just all looking at our we have this myopic view, but we have to remember that we are connected, that everything works together, that there is a conductor of the orchestra. We're going to talk about that. You all are going to see that I love metaphors. I love stories, because that is the way that I'm able to paint a picture for you.
Yes, break it down.
So you're gonna have to stop me, because I can sit here and we can go on and on and on. So you're gonna have to give me some cues and be like, okay, Dr. Lakeisha, you gotta hold up. You see, I got my pen in my hand, because I'll be jotting things down when things come to my brain, right? Because that's the way I gotta do it.
Right. Yeah.
Let's start here. Where do you want me to start? Let me ask you that. Where do you want us to start?
Yeah, let's talk about the stress hormones. We have a few Yeah, we have a few males on and females. So if you're okay with doing that.
Absolutely. So the big stress hormone we hear about a lot is cortisol. Everybody kind of hears that buzzword, that buzz hormone word, cortisol. But some of us don't even realize that our norepinephrine, epinephrine, adrenaline, those are also stress hormones. And the big person that is kind of responsible for our stress hormones is the adrenal. The adrenal glands, they kind of like run the show when it comes to stress. I tell people always, kind of think of yourself as a car, and the adrenal glands are the engine in your car. So, just like you have to change the oil in your car or it will not perform, right? We've got to take care of the adrenal glands. And I'll get back to that point and I'll tell you why we have to take care of them and how to do that. But what's happening?
Location.
Oh, that's right. And the location. So the adrenal glands are located right above the kidneys and they sit like a little beret. They look like a little beret, right? So they sit right there on top of the kidneys. And that is where they're anatomically located. Now they do have some influence over the kidneys because that's kind of the way that they regulate blood pressure as well. But for our intents and purposes, we're going to talk about how they help us get through our days. Okay. The adrenal glands are really in charge of making sure that you survive. Okay. That it makes sure that you live through the day. So this is the way I say, I live in Maryland and there's something called the Beltway. Okay.
I used to live in Maryland. 495, is that what we're talking about?
So you know where I'm going with this, right?
Ma'am.
Beltway thing. Okay. And you get up and you're getting yourself together before this, this now altered reality. And you're on the Beltway and you're trying to get to your destination. But you are in your neighbor's blind spot. And so they start coming over in your lane and you swerve and you miss that near accident. You feel that flare that comes up, right? You have those micro tremors that happen in your hand afterwards. Oh, you miss that accident. That's your adrenal glands doing exactly what they were supposed to do, help you survive. Yes. Now, this is where things go haywire, when everything becomes that car accident throughout the day. So that phone call from the boss, that bill that now we're really worried about. Mm-hmm. Now we got distance learners in our house that we are not trained to educate.
Yes. Yes. I'm the principal in my house.
Hello. And now we have family members that we're worried about that may not live in the same state. And so what is happening is that we're getting a signal from the higher brain centers called the hypothalamus and the pituitary that send a signal out saying, we've got to survive. This person has to survive. Right. So now remember that engine analogy I was giving you? Now you're kind of revving in second gear all the time, kind of like, and the adrenals are working overtime. Now, what happens is the body, and this is in men and women. So remember, we said men and women, both of us produce this cortisol.
Right. Listen up.
Both of us produce this epinephrine, norepinephrine, adrenaline to help us get through our days. Now, we are now like, okay, I've got to survive. And the body says, oh, you know what? We need calories to do that. We need to make sure that we save for a rainy day because something's happening. We're not sure what it is, but we have to make sure that they can survive. So when you eat, the body goes, okay, take this, package it up, put it in the basement, store it away as fat.
Right.
Okay, I got some more calories. Take it, package that up, boom, store it away.
Yep.
So now you're saying, what in the world is this freshman 15 that COVID-19 has now started putting on my hips? What is COVID doing to me? This is the short of the story. Your stress hormones that are trying to help you survive are actually doing what they should be doing and helping you to keep some calories just to function. So what also is happening too is that cortisol that's being turned into a little bit of cortisone is making the appetite centers of the brain less sensitive to ghrelin and leptin.
Yep.
Now that's Dr. Janine's area. That is her area. So I'm going to let her take over and talk about that ghrelin and leptin, because that is where we start. So I'm going to say hello to a couple people, if that's okay, Dr. Janine, that have joined the watch party. Hello, Zanelia. Hi, Carmen. Yemi. Hi, Dr. Monique. Hi, Miss Carolyn. And Dr. Melancon, thanks for joining. Thanks everyone for joining.
Yes. Yes, I have a few people here. Thank you, Dr. Philandy. See Demar, my cousin, Ashley, Ronald, Sheree. Sheree's laughing at the freshman 15 from COVID-19. So, so yeah, and then I have Dr. Campbell from Minnesota, my sister-in-law on. Thank you for watching. Lorraine, thank you. She says she's taking prednisone. So right now we're talking about the natural hormones in our body that we're dealing with right now, the stress hormones. So yeah, so that's a little different. That's a prescription. So Dr. Lakeisha did, talk about ghrelin and leptin. So that's one of the hormones that are affected as well. Once you have the stress hormone of cortisol. So what usually the leptin does is once you eat, that's your hormone that tells you I am satisfied. Now this is all thrown off, with the cortisol being off, everything's unbalanced. So you may not have that signal. The other signal that you should get is ghrelin. Ghrelin is the first hormone. I did it backwards, I'm sorry, but ghrelin is the first hormone that says I'm hungry, I'm hungry, I'm hungry, I'm hungry. And that may not be working properly as well. So yeah, so that's, in a nutshell, a short version of those two. Because yes, we can get down to the nitty gritty, but I think we'll bore you with that. So the stress hormones do affect weight. Cortisol acts on the fat cells, actually. There are receptors on there that interact with cortisol, and it doesn't work too well. And what happens is cortisol proliferates these fat cells. And so that's where you get, the fat around the abdomen sometimes, and also the fat that you don't see is called visceral. So that's the fat around your organs. So that is also happening. All right.
And that's the fat that I used to encounter in surgery. I didn't mean to cut you off. So that does play a role in your health. Heaven forbid you have to have any type of surgical procedure. That does play a role in how the surgery, even the course of the surgery and the post-op care. So yes, that visceral fat around the organs is a big thing.
Right, exactly. Yeah. So with folks that I know right now, you take care of women trying to balance their hormones and everything. So how do you know if they're off? What things are you seeing, and how are you diagnosing these new patients? And what are you doing about it at this point?
Great question, Dr. Janine. So part of it is a survey, and I actually have a checklist that I have available for people that want to see where they are on the hormone seesaw. Because when you think about a seesaw, it's you got to get the right balance, right? So sometimes you're too high and you're too low on one side or the other. And so the hormone checklist is really what I have people go through. There's certain questions I'll ask, especially with women. And in my book, I talk about how perimenopause and menopause is a spectrum, that you actually your hormones start depleting and start doing a roller coaster type of pattern in your life from your 40s, your early 40s, even your late 30s. We see that certain hormones start dropping.
I think I'm feeling it. My husband can tell you.
So, yes, and then there's certain labs that we want you to get, and so there are various different labs that we have you do your blood at certain times that you can have done. I don't want to go into all of that because that's a little boring, but there's certain markers that we are looking at, and especially hormones. We look for testosterone. I look for testosterone levels because yes, women do have testosterone, and it's not just for libido or your sex drive. It is implicated in a lot of other physiological processes that we get into and that I talk about when we sit one-on-one. Then we look at your estrogen, we look at your progesterone levels. And so to look at cortisol levels, there's a different test that I'll even look at. But being able to sit with someone and go through a questionnaire and be able to see what has changed. So when you're able to have that conversation, a lot of times I'm looking for what has changed and when did it change for you. So a lot of women will talk about my cycles start acting funny or funky or weird. Like they'll say, oh, it used to be like clockwork and now I haven't had a period for like a couple of months, or maybe I'm having one closer together. I talk about how in your 20s, basically mid to late 20s, you have it down packed. You know how many pads you're going to need for the day or whatever else you need. Which jeans fit for that. You just have, it's in sync. And then something happens and you're not quite sure what it was. Something changed. And when we sit down together and we talk about that, I can start helping you to understand that you're not alone. This does happen to everybody. And it's just a conversation that our mothers and our grandmothers just did not have with us because we didn't really have the terminology for it.
Right.
And so now that we do have that terminology for it and we do understand the spectrum, and we're still learning about it because we still have to come a long ways when it comes to making sure our hormones are balanced, but we can sit down, we can have this conversation. It's a checklist that I mainly go through. There are labs that we look at, and then we sit down, and because I've gotten to know you and your life and know what the demand.
Hold tight. Did I lose you?
Just a little different.
Okay. I thought I lost you for a second there. You had paused on me, but
am I back?
Yeah, you're back now. Yes. Yes.
Because everybody's a little different, then we have to customize a plan for you.
Okay. And so, like I do, I do weight loss. So a lot of women, some of them come, I put them on a plan and it's still a little hard for them in losing. So I have one patient now that has thyroid issues. So we definitely make sure that's in check because that can also affect your weight loss process as well. So do you ever get like these patients that come in, like, I've been working with a nutritionist, or I've been dieting or whatever, and I still can't lose weight. I'm sure you've probably seen that with your perimenopause women and, menopausal women, because you get some weight gain with the loss of estrogen and all that. So
absolutely. And what I've come to find is that in learning about testosterone deficiency syndrome, which is really the big part of in our 40s, what starts happening when testosterone starts decreasing, you start losing the ability to burn fat and retain lean muscle. That's part of testosterone's job. It's part of, when you go to exercise and you go to burn, that you're able to have that muscle recovery better and faster and able to kind of burn that fat around the midsection and be able to retain the lean muscle. And so when we look at that, like I tell everybody, if I could even be transparent with my own story, when I started doing integrative medicine or integrative GYN, and I had my own levels checked. And I think my husband and I shared this story on my show a while ago. I had no detectable testosterone. Like my level was less than 3.
What?
Yes. And my DHEAS.
Complaining. Was your husband complaining? Was your husband complaining?
Look here. I was wondering why did I feel like I was walking sideways and feeling crazy? And I like him as a person. Like I really like him. And I was like, what is going on? I just blamed the babies, oh, the kids, oh, this. I'm just tired, but I wasn't getting good restorative sleep either. So once I was able to restore my own testosterone levels and I started taking care of my adrenal glands, because this is the connection. So this is how it's connected. Yeah. When adrenals are revving high, they need all the resources. Yeah. And they share a common pathway with the sex hormones. So the body says, why have sex, have fun, reproduce? No, we got to make sure she survives. So shun all the resources over here. Don't make any more sex hormones. No. You don't have anything to make. Mm-hmm. So once I started taking care of my adrenals and giving them some resources and some supplements and some herbs and some minerals and vitamins, they left the sex hormone pathway alone.
Y'all hear that? Okay.
Then I was able to start taking care of my gut health, and you can talk about that. I mean, working on, now I felt better, actually. I felt that I could stick with the plan because I wasn't tired. I wasn't exhausted. I was getting better sleep because progesterone actually helps initiate our sleep. Testosterone comes in and gives restorative sleep. I was getting sleep again.
And did you notice that you lost weight easily?
Absolutely. So now when I would go to the gym, when I did my workouts, I noticed the results.
There you go.
I was like, look here, really? This is great. This is wonderful. I was like, oh my goodness, I can go ride the bike. I can lift some weights. I'm seeing a little definition in the I was like, oh, the legs aren't jiggly as much anymore.
Yes.
So I was able to then say, okay, now I can take a step back. I can now start realizing what's going on in my life in terms of what are some stressors. And a lot of times before this whole pandemic happened, we tend to wear stress as a badge and say, oh, I'm stressed out.
That rat race can get you. Yes.
And when you learn that it's really depleting you, and you really want to be the best that you can be for your community, for your family, for yourself, then you start learning no is a complete sentence and it's not a 4-letter word.
Yes, ma'am. Yes.
So yes, I was able to see a lot of difference, a lot of change.
Awesome. And so, like for women that are where their hormones are unbalanced, like the low testosterone, how do you treat them? How
Oh,
are you treating them?
so when I check and if their testosterone levels are really just depleted like mine, you really have to get some help from bioidentical hormones. So there
Okay.
are two big ways that women can get their hormones balanced in terms of bioidentical. With testosterone in particular, there are pellet therapy, there's a pellet therapy, or there's cream therapy. And so pellets are usually done by your doctor in their office. It's an outpatient, very quick type of procedure. A lot of them, the dosing that they use or that you know will be given to you is customized for you. So they look at your height, your weight that day. They look at your levels that they've gotten. You know, you have a conversation, and that pellet is actually done in the office. Cream therapy, you do it by yourself at home. So they still decide on the concentration of the amount of testosterone that needs to be in there. And a lot of them come in a little like deodorant dispenser type of container. And you just click the bottom of it and you just rub it on, usually the forearm is what you do. And then you just make sure you do it every day.
So do
Now,
you cover it because you have children at home, so you know.
yes, so it is in the medicine cabinet because it is a medication. Now, the beautiful thing about this is that it's not transferable. So you can use it. It absorbs pretty quickly, like within 30 minutes or so. So if you're just doing your morning routine, getting ready, you
Okay.
place it on before you put on any other lotions, potions, perfumes, or anything like that. Just make sure it's a dry surface, and you
So
just use the container.
androgel that men use.
Right.
So
Different. This is different. The androgel is a synthetic hormone, and that is, and I'm even seeing a lot of men that are switching over to either testosterone injections of bioidentical testosterone or testosterone pellets that did not have a good result with the astrogel. It's a little sticky and messy.
yeah,
Yeah,
yeah.
it's not the smoothest thing. So this cream is really it's very rich, it's nice and rich, but it doesn't take a lot for it to get absorbed. So that I actually use it myself, and so it's part of my morning routine. I just, put it on my forearm. I change the forearms, change it up, and I feel great. Like if I make a mistake and skip a few days, you can kind of tell.
So you're dragging, right? Yeah.
Yeah, yeah. You feel like, wait a minute, what just I'm not on top of my game anymore. What happened? And that along with my adrenal support, if I'm not doing that regularly or taking care of them through teas. So getting up in the morning, first thing in the morning, one of those things that helps support our adrenals is either some warm lemon tea or even green tea. That can help support the adrenals.
Repeat that again.
I said some warm lemon, just the warm lemon and water, just take like a half a lemon, warm water, squeeze that. That's good for the adrenal health, or even some green tea. So I'll do like just a peppermint green tea combination, no sugar. And that helps to get your adrenals to support them in the morning and get them going.
Perfect. Awesome. Awesome. And so that's how you can help balance some of those hormones naturally.
Yes, so that's how you can take care of your adrenals naturally. There are some women that come to me and they're not necessarily in perimenopause. They're even at their late 30s where they're just not feeling as balanced. Their cycles are a little off. They may even be having some heavier cycles, or something's just a little not right. So I'm doing seed cycling with them, and that's where you actually have, now I don't have the exact numbers or the exact portions in my head, but you use sesame seeds, sunflower seeds, flax seeds, and between days 1 to 14 you're using the raw seeds and you're grounding them up about a tablespoon a teaspoon of each a day. And then the second half of your cycle, you're switching over. And so these actually help to support your body's natural abilities with the estrogen to help balance out the estrogens, because we make two types of estrogens, and also the progesterone side of things. So seed cycling is used a lot to be able to just help that naturally and balance that out. And there's some teas, like raspberry tea can be done at certain times of the cycle, usually the front half of the cycle, that follicular phase, where you're trying to actually produce an egg, where the brain is getting this or giving the signal, hey, it's time to bank an egg. And so the grass is growing, I say, so the uterine lining is growing. So those are the times where you can actually do certain seeds at certain times, and that's the seed cycling process for teas. You can cycle.
Okay, great. I have a question for you here.
Sure.
From Sheree. So back to the testosterone. So she's asking, is the topical testosterone something that would need to be done forever?
Oh, great question. Oh my goodness. So this is the conversation that you have with your practitioner in terms of customization for yourself. Because there are some people that need just the support for certain times in their life. And so this is a conversation I have with a lot of my patients, where I'm saying, okay, let's look and see what's going on. What I've come to find is that when you're in the spring and summer, before this disorienting type of reality, where you could get out and about and you're probably doing more of your exercise. Some people swim, so they're out in there doing their regular routines, they're cycling more, they're doing some type of exercise, and that can also help to get your hormones balanced as well. So when you're doing that, and when the sun is out, and when the sun helps to balance these neurotransmitters as well, then you feel better. Those are some natural ways to just feel better as well. Get those endorphins up, because the neurotransmitters also play a role in our sex hormones and helping them to be balanced. Now, what I see though is that when we get to that time of the year where the light goes away a little earlier, we just don't feel as, bright and sunny. That's when you may need some support. So depending on your age, depending on the demands of your life and what we're looking at, and that's what I'm saying, if we're looking at not just the sex hormones, but also your thyroid, we got to make sure we look at the thyroid, got to make sure we look at the adrenals, because a lot of times the conversation I have is that all three of those need to play nicely together in the sandbox. Like nobody's throwing sand at each other's eyes, right? So if you are a person that may just be in a stressful time in your life, and you just need that support, and you're actually learning how to take some things off of your plate, you're learning some stress release techniques, maybe you need that support just to get you over the hump. Right. Now, as you get a little more mature in life, and your body really does stop making the hormones at levels that made you feel good, made you feel balanced, then you may need to take that. That may be part of your regimen. So when I see women that are definitely in that menopausal phase of life, is what I call it, because a lot of people feel like menopause is just one little event that happened one day. It's like, oh, I was in the menopause, now I'm out of the menopause. I'm like, well, you're kind of in that phase. That's the menopausal year. This is the next phase of your life. Then you may need that support, depending on how active you are, depending on even your medical history. So what we're also finding is that testosterone can be very good and it has anti-inflammatory properties. So I have some people that talk about how their joints feel a lot better. They just feel, a lot of that achy and the stiffness has gone away. Dr. Janine, I have a couple people on this side. Dr. Rita, thanks for joining us. Thanks so much. She said, she was actually asking, do I use the testosterone? I do. I do use testosterone cream. And I have found it to be very, very beneficial for my life at this point.
Okay. She has energy. That's great. Any other questions about treatments for hormones or?
Oh, Dr. Ken says, hello, Doctors Janine and Dr. Lakeisha. Hi, Dr. Ken.
We're talking about you too.
And you know, it's so funny because men go through andropause. So that's what they go through. That's when their testosterone starts dropping and their energy goes down. And you know, y'all don't come in until stuff down south stops working. That's when you decide to come in and say, oh my gosh, what is going on?
You rated right now. So
I know, right? So that's a whole nother conversation. But men do go through a lull in their hormones.
Okay, great. Thank you. So I know you talked about pellets. So pellets are located, where do you usually put that? The arm, the buttocks, or how does?
In the hip area, there's a little fat pocket right there that most women have. For men, it may be a little harder because they don't really have the fat around that hip area. But that's where we place it for both men and women. It's about the size of a Tylenol capsule is what I tell people to get a visual of it. It's very, very small. We also do pellets for women's for estrogen. So there are estrogen pellets too that are about the fourth of a size of that. It's very, very tiny. And so people decide to use pellets because it's kind of set it and forget it. You know, you don't have to worry about it every day. The bioavailability of it lasts a little longer. So, you know, you kind of feel that you get this longer. It lasts about 4 months.
Okay. Okay.
Yeah, 4 months. Some people, they feel a drop around the 3-month mark. And when I say a drop, sometimes they just start feeling sluggish again. Some of their symptoms will start coming back.
Oh, okay. Okay, great. Thank you. I see another question coming here. This is great, guys. Are y'all having fun? Dr. Lakeisha is a wealth of knowledge here with these hormones. Okay, so a question here. I don't have my glasses on, but I'm gonna try to do my best. So, what are the best daily vitamins for women?
Oh, great question. So, daily vitamins, if you think about, it's going to be different for the different ages, right? And Dr. Janine can even jump in on this one because we're going to need supplementation for various different areas of our lives and our bodies. So for instance, the thyroid loves iodine, it loves selenium, it loves like seaweed, the kelp. That's what it likes. And so as we get a little older, and what we're finding is that we may have started seeing where the thyroid's kind of naturally starts kind of getting a little slow. You may want to add those on a little earlier, unless there's something that happens in your medical history earlier. Most people need a great just multivitamin because our food supply just doesn't have the minerals and the vitamins and the phytonutrients like it used to.
And we're probably not getting our daily requirements, you know, with foods and vegetables and everything.
Exactly. Yeah. My grandmother, my mom's mother, you know, rest her soul, she used to garden every year. I mean, she would be out in her garden, and she was a nurse, and I don't know how she did it all, right? But her garden was always so beautiful. And I now remember her talking about not planting certain foods in the same spot. And she was talking about rotating her crops because the soil needed to regenerate or be replenished.
Right.
She would talk about that you have to, or you didn't even plant certain things one year after the next because it had, you know, pulled all its minerals and its sources out of the ground. So because we are not having that rich of a diet anymore, we're going to have to supplement. So a lot of people need vitamin D supplementation because
for us melanated folks,
we're not out in our gardens. We're not tilling the ground. We're not outside between 10 and 2 when the sun is at its highest just to get a little bit so that it can get through our skin and get that activated form. So vitamin D is the one that most people will need in the fall and winter, probably not so much in the spring and summer. A good vitamin that, it may have a complex of vitamin B in it. B vitamins are very good just to unlock our energy stores, good for our hair, our skin, our nails. It's even vitamin B's are really good for our neurotransmitters to be able to produce the dopamine and the serotonin levels and make sure that we have all of those things working very well in our brain. So a very good multivitamin. I always say if you can see the source, so if you can, if you get your vitamin from a place, right? And if you can track, if they are transparent enough that you're able to do some research and find out, maybe where they get their vitamin, their source from to make their vitamins. And there are some companies that are out there. They're like, well, we have our own farms or we source from this place. So there are companies out there. That is because you have to harvest the food and process this within a certain amount of time to get the best.
Right. Right. Yeah. And then also don't forget about your calcium, especially calcium, vitamin D, you're going to need later in life.
Yes. And so the hormones help to draw that back into the bones. Testosterone and estrogen help to take that calcium and vitamin D and make the bones nice and solid again and keep that solid bone.
Right. Hopefully that was helpful, Theo. We answer your question. Okay. Thank you. Do you have any questions on that end, Dr. Lakeisha?
No more.
All right. Okay. So how many of y'all are done hearing about hormones tonight? This was awesome. I'm right here, I'm listening. I'm like, go ahead, Lakeisha. I need to get my testosterone pellet soon. No, I'm joking.
So let's go back to this because she was asking about how can we naturally maybe even increase our own testosterone. It's really important. I go back to this all the time, the adrenals, the stress, because if we take the time to really work on our stressors, and there are ways that we can do that. A lot of times we don't feel the need to talk to somebody that may have a license in a state. We think we need to go and just talk to our girlfriends or our mothers or our sister friends, have that wine, eat that macaroni and cheese, and we're good. There are godly people, if you believe in a higher power, because sometimes we're saying, all I need to do is go and pray about it, go take it to my church family, and there's nothing wrong with that at all. I also say God puts godly people in certain areas that can help you, to give you tools to manage the stressors in your life, to even see things that are stressors, that you've just been in your own little world. So talking to a licensed therapist can really help. Meditation is another thing that can really, really help, because that can help release a lot of stress. And that helps to calm down the adrenals. That tells them, shh, we're okay, we're good. It works on the central nervous system, telling the parasympathetic system, okay, you can come out because you're the one that says everything's okay. And tell the sympathetic nervous system to be quiet. Exercise is another great way to be able to increase your own natural testosterone and hormones, and it helps with the neurotransmitters. So you can do those things, and that'll help to keep things balanced, if you're not depleted. Now, if you're depleted, you need some help. You may need a little help to get up from the basement to the first floor.
That's right. I love it.
Yeah. Oh, Dr. Rita said, what vitamins are needed for sheltering in place? That's a good one, Dr. Rita. That is a good one. I'm really promoting vitamin D, because vitamin D helps our immune system And vitamin D and vitamin C, I'm saying vitamin C in high doses, like 1,500 to 2,000 milligrams of vitamin C. Vitamin D, at least 5,000 international units of vitamin D. And so those can actually even help our mood. Vitamin D can help our mood, because a lot of us are also beginning to get cabin fever. Those of us that are used to going outside of our home for our routine are now seeing that our routine is now revolving totally around our house. And I just said to my husband this evening, you know, he has his whole routine when he comes in, because he's in healthcare. So he gets up every morning and has to go to the hospital. I'm blessed that I can do my telemedicine from home and still be with our distant learners. But he has a routine when he comes in, and I said, you know what, honey, I'm going to add one more thing to your routine. And he was like, what? I know he'll kill me about this. But he got a new pair of glasses. And he and my daughter both said, well, I'm not wearing those to the hospital. And I said, okay, fair enough, fair enough. But I told him when he comes in, I said, the next step of your routine is going to be to put your new glasses on, because that's going to help bookend your day. Because things are just blurring into your life. You know, it's just, the lines are not clear. So we have to learn to create some new boundaries and bookend our days. And that's one thing I've had to remind myself about, is you finish the work day, then we go into the school, you know, homework or whatever, and we're all just here. And I had to remember, Keisha, there's a routine that you would do at night. Still do the routine, because that tells your brain you're done. Right. This is over. This is done. Now you can move on to the next chapter.
Right. Yeah, that's great. Great advice. Thank you, Dr. Keisha. Let me see. Someone just said something here. Okay, they're agreeing with you. That's a good point. Lines are definitely blurred. That Sheree said that, and then DeMar said, great point.
Thank you.
Yes. So Dr. Keisha is here dropping gems, y'all. So y'all listen. Yes. So she gave some great tips on stress management and also how to balance your hormones. Do you have any other tips besides any foods or anything? Or so you have the sleep, the exercise, you know, the light, getting outside, walking.
Just water, remembering to drink your water. So that's part of the routine, and the lines being blurred. Again, I'm using myself as an example because I used to go out. So part of it was packing up my water bottle, you know, packing this up, packing that up for the day. And by the time I come back home, this water bottle is empty. But now I'm home. So I have to remember now to drink water. So what's going to be the new routine? You just have to create some new routines. So water, our bodies love water.
Thank you so much. Anybody have any questions for Dr. Lakeisha? We're going to try to wrap it up with our hormone and stress talk and all that, and weight gain. Let me see if anybody has any questions. Do you have any questions on your end there?
No, Dr. Rita was the last one, the great one about what vitamins are needed for sheltering in place. That was a great one.
Great. Thank you guys for being so interactive this evening. I appreciate it. This was great. Hello, Miss Carolyn from Texas. Thank you. All right, so great. I don't see anything coming through. Just a lot of loves. Oh, my mom. Hi, how you doing? Hope you learned something, Mom. Okay, so let's just wrap it up here. And Dr. Lakeisha is a wealth of knowledge. And how can we get in touch with you? Because you know, I'm like, I need to go see her for my hormone to get my hormones checked. So, and I know my husband be like, yeah, check them hormones, girl. how can we get in touch with you?
I love it, Dr. Janine. So you can find me on all social media platforms at Dr. Lakeisha MD. That's DrLakeisha MD. You can also grab your free hormone quiz at www.hormonequiz.co. That's hormonequiz.co. And you have to put the www in because it is a secured site. So you can feel comfortable giving me your email address to get that hormone quiz. So that's
one more time for me, because I'm going to just write it here in the chat.
Sure. It is www.hormonequiz.co. And then you can find me on Twitter, Instagram, and here on Facebook at Dr. Lakeisha MD.
Okay. Y'all follow her. She'll teach you all about the hormones. Come on, we got to get our energy. We got to lose that weight. We got to be balanced. Okay. It'll make you happy, your family happy, your kids happy, the world happy. Okay. So thank you guys so much for joining us this evening. Let me see, someone else just said something. Okay, all right. Yeah, so my husband has chimed in. He said, check those hormones, stat. I can't. Okay, all righty. So people thinking, yeah, I can't. So anyways, we're going to get out of here. Thank you so much, Dr. Lakeisha, for sharing with us tonight. Yes, if y'all having any problems, losing weight, loss of energy, yes, it's a stressful time, but let's look on the good side, that we have actually slowed down.
Yes.
The rat race, we're not racing anymore. We have slowed down, and it's a nice feeling, actually. The kids have no activities, so I'm not ripping and running, so it's a nice break. All right, so let's look on the positive side as well, and also, reaching out to your family, your friends. I know I've been having some virtual parties with family and friends as well, so that also helps in decreasing those stress levels too. Yeah. Okay, so you guys hanging there. We're all in this together, and stay home, stay healthy, make sure you're having a well-balanced meal. You don't have to overindulge. Okay. Fruits, vegetables, and less sweets. All right. So thank you all for being here this evening. I've enjoyed Dr. Lakeisha, I've enjoyed you. I'm Dr. Janine. I'm your board certified family doctor and weight loss specialist. I help women get their sexy back by providing a comprehensive medical weight loss program here in Pennsylvania. I do this all virtually with my business Lifestyle Changes. And also, I'm your best-selling author of Get Your Sexy Back, a Bounce Back, a guide to bouncing back after pregnancy. So you can find me at www.lifestylechangesllc.com, and you can see the services I provide as well. Okay, so thank you all for joining us this evening, and thank you so much, Dr. Lakeisha. Okay, all right, so we're signing out, okay.